Bismillahirrahmanirrahim, and good morning everyone. First of all, thank you Kawal CXO Global Forum for giving us the opportunity actually to come and meet a lot of tech leaders and also a lot of innovative people. Actually, this is amazing to see the ideas, the projects people are doing within Pakistan. Many of us are not aware of those. And I think these opportunities enable us to interact, learn from each other, and then maybe build new collaborations from this auditorium onwards. So I was asked to present today a couple of case studies about what we are doing, how the technology actually changed the way we work. And the best example is the response or our response towards COVID. So what I will do is I will just give you a little intro about the Aga Khan Development Network and Aga Khan University. And the reason why I wanted to give you a little intro of that is that you have a global institution in Pakistan, and many of these ideas, you have a place where you can connect with us. We are ready to pilot those things. We are ready to partner with all of you who have all those ideas to do. And then we have multiple different opportunities here. And that's the purpose of why I would like to give a little intro about the institution. So as you can see, Aga Khan Development Network operates in around over 30 countries in actually different continents, in Africa, in Europe, North America, and Asia, and in different parts of the world. And what we do there, the basic reasoning of why Aga Khan Development Network enters into a country is not because we wanted to earn profits from those countries. Of course, that's one vertical where we need to earn profits. But the major part is to establish, we enter to the countries based on the requests from different governments to set up different sectors. For example, education sector. For example, healthcare sector. For example, financial sectors. For example, tourism sector. And then that's what the actual purpose of why Acadian enters to different countries. So these are a couple of examples. You will see our presence in different parts. The first one is Aga Khan Academy in Mombasa, Kenya. And we have a chain of Aga Khan School of Excellence in different parts of the world to make sure that our young students, they will get a world-class quality education. The second one is Aga Khan Museum in Toronto. It's a state-of-the-art museum which presents the Islamic artwork and Islamic history in these pieces. The third one is University of Central Asia, which is operating in Kyrgyzstan, Kazakhstan, Tajikistan, and Afghanistan. And this is one of the top universities there. And the biggest part on this university is international collaborations. Our curriculum there is established between the University of Central Asia and top universities. So we do co-curriculum development, and that attracts international minds to those countries to actually know about those countries and also share their best practices. Then you can see the different type of hospitals, Aga Khan Health System, you have been aware of. And then Aga Khan University, and we have the university, and I will talk to you about that. And then we have telecom companies. For example, the first big telecom company in Afghanistan was Roshan Telecom, which was set up by Aga Khan Development Network. And then this goes in Tajikistan and other parts of the world also. We have that set up. And then we have in the tourism sector, Serena Hotels and all those things. And then for our economic development, you are aware of Habib Bank, First Microfinance Bank, and all those things. So overall, if you can see in the electricity in the sector, we are providing electricity to over 10 million people, food and nutrition around 8 million people. We have around over 400 healthcare centers in different parts of the world. And then we in our school system, we have over 2 million students who are actually getting education through our systems. And then we have 2 universities for the tertiary education. This is about the Aga Khan University. We are operating in 6 countries, that is, Pakistan is our headquarters, but then we are operating in Kenya, Tanzania, Uganda, Afghanistan, and also in the United Kingdom. So Aga Khan University and health system is one of those institutions who are headquartered in Pakistan with the global operations. So we have around 20,000 faculty and staff around these 6 countries. And then we are operating in around 350 locations with, of course, 7 big hospitals, 350 healthcare system. On top of that, we have university operations in 5 countries and also Aga Khan Examination Board. And we operate on 4 basic pillars of IQRA, I-Q-R-A. I is for impact, Q is for quality, R is for relevance, and A is for access. I will just give you one small example of impact. We were the first school of nursing in Pakistan. When we started, Aga Khan University was the first school of nursing in Pakistan. And now there are 63 schools of nursing in Pakistan. But the impact part comes in. Out of those 63 schools of nursing, 53 are headed by our students. That's the impact we are talking about. We are a small institution, but the impact, that's what we want to do. We wanted to train people so that they can go and then serve in the society. And university is another one. We are in top 100 medical educations in the world, top 20 environmental part in the world, and then top 500 within all topic universities in the world. And in Pakistan, our aim is not to attract a lot of students. We are very limited. Our aim is to bring that quality of education so that people will be exposed. Our Chancellor designers, the Aga Khan, his vision is that we cannot take all the developing people to the developed world. What we can do is that we can bring those best practices and expose our people here so that they can experience those qualities. That's the overall principle of why we are operating in this level. And then in our Aga Khan University network, we treat around 2 million patients only with our Aga Khan University network. And with our health system, we have around 5 million patients. So I will just share with you a 2-3 minute video about our response, how technology helped at AKU in responding to COVID. So can you see that we got very little time to respond to the challenges of COVID. And I just want to show you a small video to just visualize our response in that part.
As the COVID-19 pandemic spread to Pakistan, Aga Khan University Hospital promptly adapted to the situation to successfully treat the afflicted patients. When most of the city was shut down, AKU continued its operations to control this unseen and unheard of virus. We faced the situation with determination and a focus on using digital solutions to keep patients, students, and staff as safe as possible. We redesigned processes to efficiently admit and discharge COVID patients and enable data-driven decision-making to ensure smooth throughput. We also implemented work from home by securing VPN facilities for faculty, staff, and students so they could continue to work through Microsoft Teams and Zoom. We also facilitated the virtual global convocation.
During the COVID-19 crisis, our patients were not able to come to the hospital, and that's where we provided them the facility of Family Hifazat, which is a patient app. Our patients were able to use those facilities to book their appointments, to pay online, to request for lab tests and pharmacy medications. AKU IT introduced CIO app for our employees to report health-related issues and to monitor their quarantine during the pandemic. AKU also introduced TravelCheck app for airlines so that we can publish PCR COVID test results for travelers and airlines can get access to those results seamlessly.
Furthermore, we established tele-ICU facilities in hospitals across the country by establishing communication channels to allow physicians to speak with our ICU experts for queries related to COVID. The ICT department played the role of enablers and responded beyond its bandwidth to combat the impact of COVID. We were able to bring effective initiatives that helped us ensure safety and access to healthcare for our patients, students, and employees. Teamwork in times of uncertainty allowed us to realize our potential of working above and beyond in the face of this pandemic.
So I think because of the digital part, because of the technology, we were able to continue our operations. And actually all industries, whether you are in education or any other industry, people who responded quickly through technology, they were able to continue. And the people who said, no, we are going to do our own way, they are not there anymore. So I think and technology helped us in our response. And in addition to our own part at AKU, we were working closely with the government of Pakistan and also the different institutions in Pakistan to share our knowledge and also through technology. And you can see around over 5,000 critical consultations were given during the COVID time through the tele-ICU part. Around 1,500 critical patients were treated through technology from all different parts of the country. And around 21,000 healthcare practitioners were trained in the rapid change environment with the new requirements based on our best practices and based on our faculty. And also we did a lot of things together in partnership with government hospitals. Our tele-ICU was 24/7 available for consultation straight from different ICUs around the world to make sure that we can support and work together. And all this thing was done through technology, through simple means of connectivity, through simple means of user experience. Because what has happened actually in COVID, if we can just remind ourselves, is that the cases were rising, lockdowns everywhere, and then the productivity was reduced because the way we were working, it was not possible anymore. Disruptions in personal meetings, so many requirements from the regulators, and then for us, we had our patients, we have our students, and then we have our regulators to respond to. And technology actually helped us in all these fronts. And I was at the University of Central Asia during those days. I will give you an example. We were doing the Teams testing to roll out the Teams, Microsoft Teams during those times in one department, and it was taking a lot of time. And then the three governments decided that they are going to shut down in 3 days. No more is allowed in the offices, everything should be working from home. And then we were able to actually deploy Teams in 1 day because of course there was a challenge, but that opened a big opportunity, especially for the digitization part of it. We were getting fast approvals, adoption was easy, our faculty were pushed to actually prepare online curriculum so that they can deliver digitally. So all those things, and from the hospital content, our professors who were actually used to seeing patients in front of them and then talking, they were moved to screens so that they can do these things through online. So all these things, there's a huge adoption. And I always say that COVID also opened an opportunity. It resetted the entire world. If you talk with Harvard, with MIT, with Michigan, with all other top universities, they were experiencing same as we were experiencing here. They did not got that experience before. So we were learning together. So we established all these collaborations with multiple universities. They were learning from us, we were learning from them, and then there was a mutual benefit from each other, right? So I think technology actually was the backbone for running the entire operation during this part of the world. And then we have established multiple apps, online apps. Now, for example, on smartphone we have a CIO check where anyone we gave the control to patients to see their data, to actually monitor what's happening, to interact with their physicians, to actually follow their reporting part, and then wherever they go around the world. I'm based in Denmark, so my mother came to Denmark, and then she had some problem. We went to the hospital. Because of that app, because I have all her details, I was able to show the doctors there that this is the history of what is happening. And that is the power of technology, actually. So I don't have a lot of time, otherwise I would have loved to share more. But I think this is just to give you the overall gist of what we have been doing in the form of developing new tools, partnering with companies who can help us, learning from institutions from around the world, and also the entire change management of the way we were working to cope with all these different type of challenges. And these are different dashboards for our employees internally, for actually sharing with our regulatory authorities about the different type of variants. If you remember, the first COVID patient in Pakistan was treated at AKUH. So all hospitals and all institutions, they were looking at us to see, okay, what is the experience? And then we were getting different variants, and then we established these online dashboards to make sure to see the trending of what's happening around these. And similarly, it goes to the employees as well. So what are we going to do in our future? Yes, this is what we have been through. So I will just, actually the board, our board had a huge focus on future, in investing in technology in future. So in the last 2 years and the next 3 years, we are going through with the largest investment in AKU's history outside any construction project, and that is the digital electronic health record system. We are investing millions and millions to make sure that we use technology to ensure patient safety first, and then the second one is to enabling all this data which we are collecting for research, so that we can learn, we can do right things for our future. And because of that purpose, we have rolled out the electronic health record system. On 5th of November, we have already rolled out in Nairobi and 45 outreach centers in East Africa. Now, as we speak, we are rolling out in Pakistan, and then we will be going to other parts of the world. That is it's a new transformation. It's the first one. Of course, we have our in-house health information system, and many hospitals does that. But what I'm talking about is a different level of electronic health record. So from 5th of November, I can say that Aga Khan University starts speaking the global health language, which we can easily communicate to North America, Europe, different parts, and then they can communicate back to us, because we are using the same system, we are using the same practices, and now we have started the implementation in Pakistan. So what this will do is that this will actually transform the entire part. And today you will see that Michelle O'Connor, I've invited in collaboration with Kamal, the president and CEO of Meditech, the system which we are using, to just share what we are going to do. And actually what this system will do in future is that it will provide accurate information. Can you imagine you are at, any patient is at ICU, every second is important. Even though nurses are there, they go after 5 minutes, after 10 minutes to check. Can you see what would be the impact when a patient will have a bigger issue, and at the same instant there is a dashboard alarming because of all those connectivities they have, because of all that communication in between. It directly relates to the ensuring the safety of the patient. And then all this data, what we are talking about, from entering to the hospital until the entire journey, we are collecting all this data and usage of that data for our future decisions. So far, I have been saying this in multiple forums that, of course, our country has amazing opportunities, but until now, we are not focusing on research. We are relying on the outcomes of the research which happened in North America, in Europe and other parts of the world, and then the diagnosis they found based on their research, we are using that. But what about our own people? Our diet plans are different, our environment is different, right? Who is doing proper research? How much investment we are investing on our R&D part of it? And until our government, our private sector and institutions will not focus properly on the research part, how we are going to develop solutions for our future? And this is one example of how we are actually focusing, how our board and management actually thought that this is the way that we can improve, this is the way we can cope with the environment. So thank you very much for listening to me. I just want to give you a gist of what we are doing, but of course I'm happy to discuss if you have any interest. And all the startups who are here, all the representatives from different companies, I think you have tons of opportunities. Just come with proper homework and then come with solutions which can work with these environments. Just tell us where you can help us. What will be the benefit you will giving us to the institution, right? And then many of us are actually waiting there to hear those learnings from you. And we are always there to partner with you also. So thank you very much everyone and have a nice day.